Now in this video, you'll learn the most important aspects of traditional Chinese medicine, called the 8 principles. Here's Dr. Malik Cotter to explain.
These 8 principles is a guiding light. We use them a lot in herbology, but they can also be used for acupressure and acupuncture. What these 8 principles do is they tell us where the imbalance lies. The first one, external. Is it in the surface of the skin? Is it an acute condition, such as a common cold or an influenza? The exogenous pathogenic factors will affect coming into the body. You know, it's interesting that when I remember I was on a plane, I left Maui, Hawaii, and I flew into Canada, and it was April. And I thought I was on a lecture tour, and I thought to myself, well, it'll be nice weather. It's April, the end of April. Well, I got to Canada, I got to Calgary and Edmonton, and it was freezing cold. My body had to shift from an 80-degree temperature in Hawaii to a 30-degree Fahrenheit temperature in Canada. What is it that my body needed? It needed to have more heat. How did that heat come about? My burners, my triple burners, came to the rescue to increase the heat by more nervous system. My nervous system activity is what generated more heat. So we look at this in the external. Now, if I would have got off that airplane in shorts and a tank top and a pair of sandals, I probably would have caught a cold because my body was not adapted and ready, and my external aspect, my superficial part, was not ready to take the cold. So the first principle, is it external and acute? And leads us to the second principle, which is the opposite. Is it internal, and is it more chronic? What causes these internal problems? Lifestyle. A lot of it has to do with lifestyle, emotions, because our emotions affect our internal organs. Our internal organs affect how our whole body works together in harmony and in a high level, optimal health. So the internal are more chronic diseases, disorders, dysfunctions. So when we evaluate and assess, we want to know, is it external, is it more acute, which means it can go away quicker and be done with, or is it more internal, which is going to be more chronic? Digestive disorder, reproductive disorder, urinary tract disorders, neurological disorders, these are all internal. Then they lead to a chronic condition. Acute, external, can be remedied quick. Chronic, internal, actually takes a little bit more because it's deeper in the body and more has to be rectified. The third of the 8 principles is heat. Is there inflammation? Is there an infection? Is there fever? How is the body responding? Anything with an itis is going to be inflamed. There's going to be heat going on there. But where is that heat coming from? Is the heat coming from too much fire or not enough water? So we can have, this is balance, we'll call this water and we'll call this fire. And a true heat would be where the fire is in excess. And it gives the symptoms and sign of a fire. It's heat. But we also can have a water deficiency. This would be a yin deficiency, to where the yin, the water quality, is deficient, which means that the heating quality will give the appearance of being in excess, but in reality, the heat is not excess, the water is deficient. So we need to boost up the water. So you go, well, how am I going to determine this? Is it a yang excess heat, or is it a yin deficient fluid and cool? Diagnostics, evaluation, assessment, communication, talking. But what I really figure out that really works the best is the pulse. And it's very simple. I'm going to give you the 6 pulse positions in a little bit so you can see how easy it would be. So the third of the 8 principles is heat. The fourth is its opposite, cold. Cold would be excess yin. This is again where the water and the fire, where the water is excess, and or this situation where the yang, the heat, is deficient. What would show that? Chills, pale, lack of thirst, hypofunction. These are all cold. They're all cold signs. When you get the chills, you're cold. You're quivering because your body needs to generate heat. When you're too overheated, and if you were a heat condition, you would perspire because the body needs to cool itself down by getting some of the water through the pores to take the heat out. In the fourth one, the fourth of the 8 principles, cold, we're looking at excessive fluid, excessive cold, or deficient heat, deficient enough, we don't have enough fuel going. The fifth is excess itself. Now, excess is going to be to where there's a strong manifestation of the condition. Excess would be, a lot of times, constipation is an excess. It's an excess of heat that's drying out the bowels. Or it's an excess of cold, which is not allowing the body to really work, and it doesn't have the energy to move the constipated material. So we can look at excess, but usually excess is going to be a situation where obesity, this is a real clear sign of, it's a visual sign. You can see when someone is holding extra weight that there's an excess, and their excess is weight or phlegm. It may be phlegm dampness inside the body. So when we look at excesses, obesity, constipation, high fevers, infection is an excess, because this is a really beautiful part of the immune system. The immune system will raise the body temperature 1 degree. By 1 degree, it will raise the body temperature. It doubles the immune system's power. The immune system doubles. So if the body is 98.6 degrees Fahrenheit and you're running 104 fever, your immune system has now 64 times greater than what it was at normal temperature, because elevation of the body heat increases our immunity, but also elevation of our body heat burns off and kills bacteria, germs, viruses, and funguses. So when the body is in excess, there's a reason why, unless we're doing it as a lifestyle. How can you lose weight if you're, say you're 5'9" and you're weighing in at 280 pounds, which is obese, morbid obesity? How can we lose weight and get rid of that excess if we're going to continue eating fast food, packaged food, edible food-like substances? So it has to be paid attention to. The fifth is excess of the 8 principles. The sixth is deficiency. Now, deficiency means lacking energy, lowered immune system. The body functions weakly. There's not a whole lot of strength in the body. Usually in a deficiency, the person will be thin, fatigued, have shortness of breath, possibly anorexic. They'll have an intolerance to cold because there's a deficiency of heat. They'll have loose bowel movements because there's a deficiency of heat. They'll have a frequent and clear urination because there's a deficiency in the kidney yang, or in the heat of that third burning space. So deficiency is lacking qi, and it lowers our immune system. And that's the sixth of the 8 principles. And there's ways to pick this out. It's not a big mystery. We're going to demystify the whole thing for you in a little bit. Now the last two, 7th and 8th of the 8 principles, are yang and yin. And what these basically do, these basically tells us the overall of how the body is working. Yang is going to be more external symptoms, heat and excess. Yin is going to be more internal influences, cold and a deficiency. The cold is over in the yin situation, the symptoms internal. It's going to be cold in there, it's going to be weak, it's going to be deficient. On the yang side, it's going to be external, it's going to have excessive heat, and it's going to have excesses of other substances, other fundamental substances of the body. So when we look at the different ways to evaluate and assess a client, you can use these 8 principles. In the next video, we'll we'll go into a deeper understanding of how to use the triple warmer to assess also a client.